Welcome back. I'm Michael Stamatinos, your host with the Advancing Healthcare Innovation Show. And if you're new to us, we're super excited to have you here. We also happen to be crazy passionate about healthcare innovation and adoption. And if this is your first time tuning in, let me just kind of tell you a little bit about what we do here. So we're a healthcare innovation company. We're focused on bringing stories of innovation within healthcare to life. And our aim is highlighting real people that are truly innovating within our space and giving them a platform to share their stories with our audience, and which is a global audience. So we've got an incredibly action-packed year. We've had some amazing guests that have come onto the show over the course of the last 12 months. So if you haven't checked out any of the historical interviews, make sure you go out and do that there, and then hit subscribe now wherever you are. So when new episodes do come out, they come right into your inbox. So super delighted to have our next guest come onto the show. He happens to be a friend, a pretty damn good soccer player, Eric Tower, healthcare partner, Thompson Coburn. Eric, welcome to the show.
Thanks, Michael. You give me too much credit, both as a soccer player and as a desirable guest, I guess. And I'm honored to be invited and flattered, to tell you the truth.
So I think a lot of people might think about, well, what does an attorney, innovation, do those two things go hand in hand? Would you maybe mind giving our audience a little bit of a backdrop of sort of your story? And I think because your background in healthcare is vast, especially kind of come from where you've come from. So I think that might kind of give the setup for today's conversation some nice context.
Sure. Well, long ago, I practiced in Washington, D.C., doing what we called for-profit healthcare, because there was no such thing as private equity back then. At least no one used the term. And it was a lot of work with a lot of people who had sort of innovative business models and roll-up acquisition work. So this was not your traditional sort of healthcare system work. It was working, in areas that were undergoing, they were in a state of flux. And a lot of times what I had to do was learn how the reimbursement worked, how the business worked. And then over that, we would lay, how do we do the deals? How do we keep people out of jail? How do we set things up so that we can get paid? I ended up going in-house at a large health system for 16 years. It started off a little slow, and then all of a sudden it sort of accelerated, and we were doing the same thing in the system. At a point, I ended up leaving the system and going back out. And now I'm back in private practice at Thompson Coburn. The firm itself provides, services to the continuum. My own practice has been a little more on the disruptors and the people who are looking at changing the status quo and innovating in the field of healthcare. That's my own personal preference. I really like that. A lot of that is value-based care. There are other models for how innovators can take place. Some people, they take a bunch of practices, for example, and they take them out of network and they charge people at a very high rate. And, I don't have any clients who do that, but that is common. Other people put on a bunch of ancillaries and they tell these groups, well, you can grow. That's fine. You can, and you can do that in a way that helps people. And I do have clients who do that. And then others are really targeted at what we call value-based care. And what they want to do is they want to drive down healthcare costs across the board. And the idea is that they get some of that upside for themselves. And those are the really fun ones to work with. So I'll stop there.
So when you talk about value-based care, I feel like it's so overly used, and you kind of hear remarks from both sides, whether it be on the provider side saying that, look, people talk about doing value-based care, but who's actually really doing it, and who's actually really making money? I mean, let's start there. I mean, healthcare is a business, right? You follow the money. We're going into 2023. Where do you see value-based care sitting on the spectrum of actually being more mainstream? Are you seeing it now in sort of the deal flow that you're managing? Or, I mean, how real is it from just from a broader perspective?
Yeah. In my practice, it's very real. That's the vast majority of the work I do is with entities. And a lot of times it's not so much we go and advise them, hey, there's value-based care, there's this opportunity. A lot of times it's along the lines of, okay, we have this model. We need to expand it because to do value-based care, a lot of times that means taking capitation, you take a per member per month fee, or else you manage care for a population and you get maybe shared upside. So if you save the payer money, you get to split it somehow. But it's very hard to do that unless you're doing that on a large scale, and you need a lot of data and a lot of analytics to do that. And that's where a lot of my clients are going. You've got health systems now, and they face a real quandary, and I appreciate the quandary having been with a health system, right? So we've got all these fixed costs, we've got these hospitals, and under value-based care, what we want to do is we want to take people out of the hospital and care for them in a lower cost environment. But the hospitals have all the staff, they've got the beds, the bricks and the mortar, the debt, which is typically quite high. And I can't flip a switch and take people out of my hospital unless I can somehow backfill that. And that puts them in a real dilemma. And in all honesty, if I had an easy answer for that, I'd be really rich. The quandary. The real issue is not that health systems are going to completely go away, because I think we all need hospitals at some point. I mean, trauma and severe care, right? You can't do everything as hospital at home. But how do you marry that? And how do you make it a situation where you're keeping that skill set while also driving down costs? I think that's the real dilemma. And that's sort of where you see a lot of people on the innovation, the tech side, they're trying to struggle with, well, how do I partner with people and get paid for it myself while we're taking people out of the hospital? And it's tough.
Well, if they're truly wanting to partner, a lot of innovations around collaboration and partnership. If they're really truly looking to partner, do you find that there's hard to find middle ground where they're taking people out of the hospital and yet somehow the hospital benefits financially? Where, from a legal standpoint, I mean, can you comment around that? How maybe you've come up with some interesting models, some examples of how to make that work?
Well, plenty of people who are a lot smarter than me have posited that what is likely to happen at Dave Morlock at Cain Brothers, for example, top thinker in the field, has said he thinks that health systems are going to evolve into partnerships with private equity and sort of aggregators of healthcare. It'll be interesting to see how that plays out. I think within the health systems, you've got some people whose whole lives have been this sort of fee-for-service, fragmented care model, and they're comfortable with that. As we talk about integrating care, people worry about Big Brother watching me. There's a lot of talk about social determinants, and does that mean I'm going to get penalized if I open a beer or eat a Dorito? There's a lot to wrestle with and unpack. One of the speakers at the seminar I hosted, Robert Friesen, went on about the social determinants and how obesity has increased in society, and what do we need to do even outside of the healthcare system to get people healthy to drive down healthcare costs. I think one thing that's really interesting right now is there's so much innovation percolating around, and it's a lot of fun. The first question you always ask on any deal is, how am I going to get paid? And one problem I've seen is people plunge ahead with this stuff, and then they say, well, now I need to get paid. You need to start there first, right? And you need to come up with that before you can really enter into a collaborative relationship. And for anyone who's watching, I'd say you gotta nail that down first.
For some of your clients that you're able to the degree that you're able to speak, what has been the most successful thing that you've seen thus far in terms of innovation, collaboration, all of this kind of working together while also staying within, staying outside of troubled areas? Is there anything that you can kind of bring up and speak to that you think is worthy of just sort of sharing?
Yeah, well, if you, in the area of primary care, for example, historically, health systems lose money on primary care doctors. They view it as acceptable because we all know if you have the primary care patients, they're going to end up in your hospital, and that's where you're going to make your money. So unfortunately, in some contexts, the physicians feel like they're an afterthought. There are a number of innovators, I'll throw out Village MD, ChenMed, Oak Street. They focus on bringing the healthcare to the patient, keeping the patient healthy, and then they make money if they keep healthcare costs down. I'm grossly oversimplifying, but that's
right.
the way it works. I think there's a lot there. I think that is likely to be a very successful model if they have the data analytics. So you find out you've got women over 50 should have a mammogram every other year. We're going to help make sure they're scheduled and they get the mammogram, and then we can catch cancer early, keep the women healthier. They don't, it doesn't progress. We don't need the same kind of interventions, and everyone's better off. I'm kind of a firm believer in that, to be honest. Some of the tech stuff I think is really interesting and innovative. I've done some work with remote patient management and that kind of thing. I think the difficulty there, though, is you get some people who come in and they view things as strictly a tech problem. And I'm not sure that you can only approach it as a tech problem, because healthcare by definition is about people. And so, if I'm looking at that part of the continuum, it becomes a marriage between your tech, your data, and then your ability, your boots on the ground to actually get in and see the patient, right? So some of the companies I've seen, there's this assumption that an 80-year-old woman or man is going to be able to manage an iPhone and interact with this technical component. And I think that might be, it's fine for someone who's younger, who grew up with that stuff. I think it's a little tougher when you're introducing to that someone at that point, especially a lot of them have dementia potentially. They didn't grow up with the technology. You're asking them to change to accommodate the technology instead of vice versa. And I think
so. So as an attorney, though, most people think of attorneys. I'm just going to say this. Hopefully, this is not a knock or a generalization to all attorneys out there, but they're placed within a certain bucket. It just seems as though you're a little bit more integrated inside of the business. Is that your main philosophy as an attorney, or is that usually the mindset of an attorney going into a particular situation with a client, or do they think, each of them think kind of differently, more transactional versus? Just seems like you're more relational based. You're really embedded in there.
Well, my philosophy is clients, and I'm going to ask the apologies of the legal profession. Clients don't necessarily like hiring lawyers. They don't like hearing legal answers. Typically, they have a business problem that has a legal component to it. And if I give an answer that's strictly legal and doesn't take into account their business, what their drivers are, what the motives are, what the behaviors are, I'm not doing them any favors. That's one thing Thompson Coburn prides itself on is, and we really want to roll up our sleeves and be a business partner. Anyone can write a memo giving an analysis of a legal issue, but if I get it and it doesn't apply to my business, it doesn't do me any good.
So you mentioned about private equity money coming in, hospitals consolidating. Do you see that changing anywhere in the short term? Just kind of given that, I think I read a stat somewhere, 54% of hospitals are operating, in the red. How do you see this playing out moving into 2023? Not to say that you've got a magic crystal ball, but if you could draw upon some of your experience and historical trends that you've seen, what do you see happening?
Yeah, that's a great question. I hate to say I've seen it before, and history doesn't repeat itself, but it sure rhymes. I remember the old physician practice management companies in the 1990s. And the idea there was, well, we're going to aggregate a whole bunch of practices and consolidate the back office and make money. The problem was, you get a slight lift maybe if you do that. And then what's in it for the doctors? Because everything was done on, their performance in the office. There was no real change to the underlying reimbursement model. I think what we're seeing more and more in 2023 is people are realizing, well, there are these huge losses and we got to do something. Another thing that's happening with Medicare in particular, but other payers as well, is they're saying, look, if this service can be provided outside of the hospital, I'm not going to pay the hospital a boosted rate because they referred it into the hospital. That's here to stay. 2023, I think it's really starting to hit. I think some of this stuff was delayed by COVID and the PPP payments and all the other good stuff, but we've got to solve for that. And the health systems themselves, I've seen them buy stuff and I've seen them sell stuff. I don't necessarily think health systems are going away, but I do think that they're going to have to find a way to do something other than just focus on hospital services. And to do that, they're going to have to engage with other people in the continuum, home health, physician groups, et cetera. And a lot of times that's going to be through private equity. So there is going to be a change over time in how we perceive what a health system is.
I mean, there are health systems that have physicians in-house, that have home health in-house.
Yeah.
Are they better off in terms of how they're innovating when things are kind of vertically aligned that way? What have you seen in your experience?
Yeah, I think the issue that health systems have to resolve is, okay, we've got home health. Okay, we have physicians. How do we align them and get them working together? And then how do we approach the payers and say, hey, by the way, we're saving you money. We're losing business out of our hospitals at a tremendous cost. You need to give us something in return. I think there's a continuum of how people view that being perceived by the payers. And I think there are a lot of healthcare executives rightfully concerned that if I do this, the payers are just going to say, thank you, you saved me money, and let us wither on the vine. At the same time, we've now got a lot of payers moving into providing the non-hospital part of the service. I could name names, but we all know who those are. And there are plenty of them. So we're really seeing a lot of the old lines, both within the health systems, the payers, and again, on the ambulatory side in general, all starting to blur. So it's a time of tremendous ferment. And then we could add tech in, right? So the old critique of the HMO was, well, these doctors get capitated, but if I send the patient to the hospital, that's not capitated. So the hospital makes money. The doc kind of says, okay, adios, and everyone's kind of happy, but the patient isn't any better off. And so people weren't, the doctor was just sort of a gatekeeper. And then the HMO said, no, you can't get care. Well, now with the technology we have, we can keep people out of the hospital. So I do think that this era is kind of materially different than what we saw in the 90s with HMOs. How it ends, I couldn't tell you.
I mean, talk about data being disparate in different areas. From a legal standpoint, is there a way to enforce that data is shared for, I guess, from an altruistic standpoint? I mean, if you're caring for people, a health system is embedded within the community. You're there, you're caring for the community. Is there something that can enforce them to share information so that the care for community is actually occurring at a better, faster, more efficient rate?
Yeah, I think, probably every health system I can think of is sinking a ton of money into, the electronic medical records. And a lot of them are doing the data warehouses that sit on top, and they're trying to scrape and aggregate data. One of the issues that I've seen in the past is, hey, if I'm on Epic, the medical record system, I can't get that data over from Cerner. If someone goes to the pharmacy, I don't know if they got their script refilled or not. So there are holes in the system. I think a lot of people are trying to brainstorm, how do we fill those holes? How do we get that data under one place? I wish I could say, things are seamless and people wave a magic wand. I do think a lot of people are working on this, and there has been a lot of success in many cases. Some of the people I named before have really begun innovating there, but we can do more. There's no doubt.
Well, who's disappointed you? Not to name names, but what have been some of the biggest disappointments in terms of thinking that innovation is going to happen, but really hasn't delivered? Is there anything that you can share without throwing anyone under the bus? I know that we're here to provide good news, but innovation is about wins and losses, and sometimes things don't go as planned. Anything that you can share that is worthy of sharing?
Just speaking generally, there are plenty of actors who found a way to make money, right? And that's great. And we can drive up the total cost of care, but we're not doing anything that benefits society at large. So, we can, the idea is, well, we're going to add scale and we're going to add stuff and we're going to make money that way. And they're not thinking about a patient-centric approach or a physician-centric approach. We can add on ancillaries, or we're going to go out of network. And when a patient comes in, they're going to get hit with some pretty big bills, and then we're going to sick the bill collector out. That disappoints me. I don't think anyone really wants that. I think there's a growing perception that that's a real problem. And I've had people come up and approach me and say, hey, we want to do this kind of roll up that's going to accomplish that. And I'll be honest, I've kind of said, I think you got to go somewhere else, because it's a personal decision. I don't, if I see your business model and I don't think it's going to help solve a problem, I feel an obligation to kind of say, well, here's some other people you might be able to work with, but it's not me.
Interesting. How can people kind of follow your work, follow what Thompson Coburn's doing? What's the best way to kind of keep tabs on some of the wins, some of the innovations that you guys are doing with your clients? How can they follow your work?
Well, we recently had a seminar that we recorded on the future of healthcare. That's available at the Thompson Coburn website. I'll give a plug.
I'll put the link in the description.
Yeah. Give a plug to my own podcast, Talking Pop Health. I've got a lot of sort of thought leaders on there. They're sort of different. Your focus is more on the innovators and the tech kind of startups. Some of these people might approach things a little more from the health system view. Not all. Write articles. I've had a bunch that I've pushed out, and again, those are on the Thompson Coburn website. And frankly, if anyone wants to have a conversation, I'm not going to look to sign anyone up as a client. I just love having the conversations. There's a lot of potential here, and I think I personally sometimes get a little too down or a little too negative about where things are. Healthcare is over 20% of GDP now, right? Huge. I mean, I remember when people said 15% was the tipping point, and look where we are. Yeah. But from that is coming a lot of innovation and a lot of cool stuff. And again, the thing I caution a lot of innovators is, your first thing is you need to figure out how you're going to get paid. The other thing is, once you figure out how you're going to get paid and what your model is, focus on executing on your model. A lot of people kind of get hungry and they want, I can do this too, and I can do that too. And I think that just becomes a big distraction, and it really stops them. Come up with that model and do it time and again till it's perfect. And then you can consider other stuff.
Well, I mean, sometimes I've seen that happen where people get shiny object syndrome, and that's a very real thing. Where is there sort of a happy medium where you can experiment on a model, kind of then discern that, hey, maybe this model isn't the right pivot, making slight pivots? Where do you come in as someone looking at it from a specific perspective? When do you know that, hey, this model isn't working? I mean, is this as black and white, or is this a little bit of art to it?
You know what? There's a bit of art. Just by virtue of my background, I've gotten used to kind of scaling. So, what I've done in particular with one client is we have a written playbook. That's the product of doing things a number of times and we adjust it. You tend to templatize your business models. So by trial and error, and usually it takes a few times before you can really start settling into this. That's what you do. And then you execute on that. But you're always revisiting the process. You're always saying this worked here. And I got to be honest, even having done this for a number of years, there's still times when I say, oh, I wish we would have caught this, or I wish we would have thought about that. But that's sort of life. You're never going to catch everything. Nothing is perfect. But you do have to sit there and be willing to kind of, okay, I'm going to plan this out. I'm going to map it, and we're going to try to do it again and again. But we're always revisiting it. The companies that do that, I think, can do extremely well. But it takes a certain level of discipline.
Yeah, I know we're kind of getting towards the end here, but I'm just curious because you've seen at least the last couple of years a lot of money coming into healthcare, and how do you react to that? Generally, I think there's some folks that are on one side of the fence that don't seem to be too keen on it. Others on one side of the fence that are saying, look, the private equity money coming in, you see what they have the capacity to do. They streamline things, they make things more efficient. What camp are you in as it pertains to that?
Well, that's a tough question. I would say this. I think value-based care is here to stay. I've also told people at my firm, maybe we need to start looking at how the bankruptcies that might come, because people are throwing money in. And, I hear the business model and I think, well, I don't think this is really going to work. I'm not sure this entity is going to survive. Now, that doesn't mean everyone goes away, right? In the 1990s, we had the physician practice management companies, health systems and others, stepped in and scooped up, or some of the doctors just went out into private practice. If you look at some of the tech stuff, it's great, it's valuable, but maybe it's not valuable as a standalone. It needs to be in conjunction with a bigger platform. So I think there's a lot of room there. Will all the money get returned, with interest that private equity wants? No way.
Interesting. Well, Eric, it's been fantastic to have you on. At least you've been honest. You haven't been shy about, sharing your thoughts, and I'm appreciative of that. And for those that have joined us today, if you found this interview valuable, would you mind sharing it on social media? Would you mind commenting on it, talking, maybe even just indicating, what's something that really stood out to you, and even sharing it, reposting it? Every little bit helps. And I'm grateful when we have innovators that want to come in, that want to make a difference, that really want to advance healthcare forward. And Eric, just even though, because you're looking at this from an attorney's perspective, I still think your greater mission is to advance society at large. You just so happen to have a specific lens that you're looking at it from, but it's really brilliant to see that. So I'm grateful to have you on the show, and obviously you're always welcome to come back.
I'm flattered you had me on. I appreciate it.
You bet. Catch up soon.
Thanks.